Welcome back to 11 Alive News this midday. I'm Jonathan Martin. Well, the CDC's Vaccine Advisory Panel is meeting right now in DeKalb County to decide whether to update recommendations for COVID-19 and Hepatitis B shots. Ariana Manise has been following this story. She's live outside CDC headquarters. So, Ariana, what exactly are they planning to vote on today?
Well, later on today, we're anticipating them to vote on COVID-19 shot recommendations for this upcoming fall. And their decision has big implications as it will determine how doctors recommend these shots, how insurance policies cover whether you can get this vaccine, and also state policies. So before this vote, right now, members of this committee and experts are going through data related to COVID-19. We've learned so far that COVID-19 vaccination rates stay low for kids. Just 5.6% of those under 4 and 13% of kids 6 months to 17 are up to date on their COVID-19 vaccine. Adults 65 and older saw small gains, and they say that vaccines still protect against severe illnesses, especially for older adults, and maternal shots help shield newborns. Officials say vaccines remain important even as some already have immunity from past infections. Now, this data comes as the FDA has already submitted their approval on COVID vaccines, which has created some confusion leading up to the panel's meeting this week. The FDA has already approved the vaccine for people with underlying health conditions, or if you're 65 and older. The previous recommendation was an annual COVID shot for all Americans 6 months and up. There's concern that the CDC panel could tailor their recommendations to the FDA's approval, which could limit access to the vaccine for everyone who wants to receive it. Now, this advisory group's recommendations, it is not final. Once again, they're expected to vote on the COVID-19 fall vaccine recommendations later on today. Once again, that's not final. The CDC acting director will have to sign off on whatever recommendations this committee submits. Back to you, Jonathan.
All right, we'll be following this and have updates later in our newscast today. Ariana, thank you so much.